I'm going to talk about the oral health strategies for patients with acid reflux. This is pretty straightforward stuff as far as what the issues are. It's pretty specific. When you regurgitate acid on a pretty consistent basis, this is going to get into your mouth and you're going to have acidic tooth erosion. The conversation here is more acid than it is bacteria, even though bacteria is always a consideration. In this particular instance, we're going to be talking more on the acidity. So you're going to have a salivary imbalance, tooth sensitivity, for sure halitosis, bad breath, and you could get mucositis, which is an inflammation of the tissue in your mouth. So we need to talk to your gastroenterologist as far as like your treatment plan and what we need to be doing to protect your teeth, while their overall focus is reducing the acid regurgitation. The dental objectives include neutralization of the acid attacks, okay? Whether or not this is something that happens at night or is a more consistent thing, we need to reduce the permanent damage to your dentition. So we're going to do some salivary diagnostics and look at the buffering capacity of your saliva, what kind of challenges your saliva is having with these acid. So this is a chart that I had made up, and when we talk about decay, this chart also comes into play, but this is acidity challenges with your saliva and what happens there, okay? So we'll go through the protocol. We're going to look at the bacteria, but the primary focus is on salivary balance and a specific halitosis bad breath protocol. Okay, so home care recommendations here are similar to previous entities with one exception. We're probably always going to use trays. You're probably familiar with bleaching trays or mouth guards. We're going to use trays with various medicaments, fluorides, and other things to protect the teeth on a daily basis. You have to do this when you have a constant acid challenge. This is what a LAD, local area delivery tray, looks like, and this is a gel being placed in the tray that can be worn for 10 minutes, morning and night, something like that. Okay, and we're going to set up a recare interval that's, consistent with stability. What we're trying to prevent is permanent damage. When you have acid erosion, the implications are gigantic. You can destroy over time your entire dentition. So you're faced with your choices become two things: have all of your teeth extracted, which is a giantly traumatic thing, or have what we call a full mouth reconstruction, where crowns or caps are placed on all of your teeth, because all of your teeth can be pretty much evenly destroyed by recurrent acid attacks.